Hello, everyone. This is Nurse Anna from nursestudy.net, and today we're going to be doing meningitis, both bacterial and viral. This is 50 questions, multiple choice with answers and rationales. Enjoy. And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 27-year-old patient presents to the emergency department with a high fever, severe headache, photophobia, and neck stiffness. A lumbar puncture reveals a cloudy cerebrospinal fluid (CSF) sample with elevated protein and decreased glucose. Which intervention should the nurse prioritize? A. Administer broad-spectrum IV antibiotics immediately. B. Perform a CT scan of the head before continuing with treatment. C. Initiate seizure precautions and place the patient in isolation. D. Administer IV corticosteroids to reduce inflammation. Correct answer, A. Rationale: meningitis, particularly bacterial meningitis, is a medical emergency requiring immediate administration of broad-spectrum IV antibiotics before waiting for culture results. A CT scan, option B, may be necessary in some cases before a lumbar puncture, but is not the priority here. Seizure precautions, option C, and corticosteroids, option D, are important but secondary to starting antibiotic therapy. Question 2. A nurse is assessing a 3-month-old infant diagnosed with bacterial meningitis. Which assessment finding is most concerning? A. Bulging fontanelle. B. Irritability and high-pitched cry. C. Petechial rash on the trunk and extremities. D. Fever of 38.5 degrees Celsius, 101.3 degrees Fahrenheit. Correct answer, C. Rationale: a petechial rash may indicate meningococcal sepsis, a life-threatening complication of bacterial meningitis. While other symptoms, options A and B, are common in infants with meningitis, the presence of a petechial rash suggests disseminated meningococcal disease, requiring immediate intervention. Question 3. A 45-year-old patient with suspected bacterial meningitis has a positive Brudzinski's sign. What does this indicate? A. Increased intracranial pressure. B. Nuchal rigidity and meningeal irritation. C. Impaired level of consciousness. D. Seizure activity. Correct answer, B. Rationale: a positive Brudzinski's sign, where the patient involuntarily flexes their hips and knees when the neck is passively flexed, is a classic indication of meningeal irritation. It does not specifically indicate increased intracranial pressure, option A, although meningitis can cause this. Question 4. A nurse is preparing to administer dexamethasone to a patient with bacterial meningitis. What is the primary reason for this intervention? A. To manage pain and fever. B. To prevent seizures. C. To reduce inflammation and prevent neurological complications. D. To lower intracranial pressure. Correct answer, C. Rationale: corticosteroids like dexamethasone help reduce inflammation in bacterial meningitis, which can decrease the risk of neurological complications such as hearing loss. While reducing intracranial pressure, option D, may be a secondary benefit, the primary reason is to limit inflammatory damage. Question 5. A patient with bacterial meningitis is at risk for increased intracranial pressure, ICP. Which of the following findings should the nurse report to the healthcare provider immediately? A. Glasgow Coma Scale, GCS, score of 10. B. Systolic blood pressure of 160 mm of mercury and bradycardia. C. Fever of 39 degrees Celsius, 102.2 degrees Fahrenheit. D. Nuchal rigidity and photophobia. Correct answer, B. Rationale: hypertension with bradycardia suggests Cushing's triad, a late sign of increased ICP requiring immediate intervention. A GCS score of 10, option A, indicates moderate neurological impairment but is not the most critical finding. Question 6. Which of the following patients is at the highest risk for developing bacterial meningitis? A. A 19-year-old college freshman living in a dormitory. B. A 40-year-old patient with a recent sinus infection. C. A 7-year-old child recovering from chickenpox. D. A 55-year-old patient with a history of hypertension. Correct answer, A. Rationale: college freshmen living in dormitories are at higher risk for meningococcal meningitis due to close living quarters. While a sinus infection, option B, could be a risk factor, the highest risk is in young adults living in group settings. Question 7. A patient with bacterial meningitis is receiving IV vancomycin. What is the most important nursing action during administration? A. Monitor for signs of nephrotoxicity and cytotoxicity. B. Encourage increased fluid intake. C. Assess for signs of peripheral neuropathy. D. Monitor for signs of hyperglycemia. Correct answer, A. Rationale: vancomycin can cause nephrotoxicity and ototoxicity, requiring careful monitoring. Peripheral neuropathy, option C, and hyperglycemia, option D, are not primary concerns with vancomycin. Question 8. A patient with suspected bacterial meningitis is scheduled for a lumbar puncture. Which action by the nurse is most appropriate before the procedure? A. Keep the patient NPO for 6 hours. B. Assess for signs of increased intracranial pressure. C. Administer broad-spectrum antibiotics. D. Place the patient in the supine position. Correct answer, B. Rationale: a lumbar puncture is contraindicated in patients with increased ICP due to the risk of brain herniation. Assessing for signs of ICP, i.e., papilledema, altered consciousness, is crucial before proceeding. Question 9. A nurse is educating a patient recovering from viral meningitis. Which statement by the patient indicates a need for further teaching? A. I need to drink plenty of fluids to stay hydrated. B. I should avoid bright lights if I develop a headache. C. I may feel tired for several weeks after recovering. D. I need to complete my full course of antibiotics. Correct answer, D. Rationale: antibiotics are not used to treat viral meningitis, as it is caused by a virus, not bacteria. Treatment focuses on supportive care, hydration, and symptom management. The other statements are correct and reflect appropriate self-care after viral meningitis. Question 10. A nurse is reviewing discharge instructions for a patient who had bacterial meningitis. Which statement by the patient indicates understanding? A. I should avoid close contact with others for at least 2 weeks. B. I may develop long-term complications such as hearing loss. C. I don't need to follow up with a healthcare provider. D. I can return to work immediately since I'm no longer contagious. Correct answer, B. Rationale: bacterial meningitis can lead to long-term complications such as hearing loss and cognitive impairment. Patients should have follow-up appointments for neurological assessment. Question 11. A nurse is caring for a patient with bacterial meningitis who suddenly develops a heart rate of 50 beats per minute, irregular respirations, and a widened pulse pressure. What is the nurse's priority action? A. Administer IV mannitol as prescribed. B. Lower the head of the bed to improve circulation. C. Notify the healthcare provider immediately. D. Perform a focused neurological assessment. Correct answer, C. Rationale: the patient's symptoms indicate Cushing's triad, bradycardia, irregular respirations, and widened pulse pressure, a sign of impending brain herniation due to increased intracranial pressure, ICP. Immediate intervention by the healthcare provider is required. Question 12. A nurse is providing care to a 9-year-old child diagnosed with meningococcal meningitis. Which infection control precaution should the nurse implement? A. Standard precautions only. B. Droplet precautions for 24 hours after starting antibiotics. C. Contact precautions due to the risk of transmission. D. Airborne precautions to prevent respiratory spread. Correct answer, B. Rationale: meningococcal meningitis requires droplet precautions until the patient has been on appropriate antibiotics for at least 24 hours. Airborne precautions, option D, are unnecessary, and contact precautions, option C, are not required unless there are open wounds or significant bodily fluid contamination. Question 13. A patient with bacterial meningitis reports worsening headache and confusion. The nurse notes sluggish pupil reactions and increasing blood pressure. What should the nurse do first? A. Increase IV fluid rate. B. Notify the healthcare provider immediately. C. Administer IV pain medication. D. Reassess in 30 minutes. Correct answer, B. Rationale: these are signs of increasing intracranial pressure, ICP, which requires immediate intervention. Delaying assessment, option D, could lead to brain herniation. Pain medication, option C, will not address the underlying cause. Question 14. A 20-year-old college student is diagnosed with viral meningitis. What discharge instructions should the nurse provide? A. Avoid sharing personal items such as drinking cups and utensils. B. Take the full course of antibiotics as prescribed. C. You should isolate yourself for at least 2 weeks. D. Report any new bruising or bleeding to your healthcare provider. Correct answer, D. Rationale: viral meningitis is usually self-limiting, but some viruses, e.g., enteroviruses, can cause complications such as thrombocytopenia. New bruising or bleeding may indicate a serious condition. Antibiotics, option B, are not used for viral infections. Question 15. A nurse is reviewing laboratory results for a patient with suspected meningitis. Which cerebrospinal fluid, CSF, finding is most indicative of bacterial meningitis? A. Elevated protein and decreased glucose. B. Normal protein and glucose. C. Clear CSF with normal white blood cell count. D. High glucose and low white blood cell count. Correct answer, A. Rationale: in bacterial meningitis, CSF analysis typically shows elevated protein and decreased glucose due to the metabolic activity of bacteria consuming glucose. Viral meningitis often has normal glucose levels. Question 16. A nurse is preparing to administer ceftriaxone IV to a patient with bacterial meningitis. What is the most important nursing intervention before administration? A. Assess for allergies to penicillins or cephalosporins. B. Monitor for hyperkalemia. C. Encourage the patient to increase fluid intake. D. Check the patient's blood glucose levels. Correct answer, A. Rationale: ceftriaxone is a cephalosporin, and patients with a penicillin allergy may have a cross-sensitivity reaction. The other options are not primary concerns before administration. Question 17. A nurse is monitoring a patient with meningitis who has developed SIADH, syndrome of inappropriate antidiuretic hormone. What is the most appropriate nursing intervention? A. Administer IV normal saline at a rapid rate. B. Restrict oral fluids. C. Encourage high-sodium foods. D. Monitor blood glucose levels frequently. Correct answer, B. Rationale: SIADH causes fluid retention and hyponatremia, so fluid restriction helps prevent worsening symptoms. High-sodium foods, option C, are not an effective primary intervention. Question 18. A nurse is educating parents of an infant who will receive the Haemophilus influenza type B vaccine. Which statement indicates the parents understand the purpose of this vaccine? A. It protects against viral meningitis. B. It prevents bacterial pneumonia. C. It reduces the risk of bacterial meningitis caused by H. influenza. D. It is a treatment for meningitis, not prevention. Correct answer, C. Rationale: the Haemophilus influenza type B vaccine helps prevent bacterial meningitis caused by Haemophilus influenza type B, which was once a leading cause of childhood meningitis. It does not protect against viral meningitis, option A. Question 19. A 30-year-old patient with bacterial meningitis is receiving phenytoin, Dilantin. What is the primary reason for this medication? A. To prevent seizures. B. To treat bacterial infection. C. To reduce inflammation. D. To relieve headache pain. Correct answer, A. Rationale: phenytoin is an anticonvulsant used to prevent seizures, which are a potential complication of meningitis due to increased intracranial pressure. It does not treat infection or inflammation. Question 20. A nurse is teaching a community group about meningitis prevention. Which statement requires further teaching? A. Vaccines such as meningococcal and Haemophilus influenza type B can prevent some types of meningitis. B. I should complete my full antibiotic course if I have close contact with someone diagnosed with bacterial meningitis. C. I can stop taking my antibiotics once I feel better. D. If I develop a stiff neck, fever, and headache, I should seek immediate medical attention. Correct answer, C. Rationale: patients exposed to bacterial meningitis may be prescribed prophylactic antibiotics, and stopping them early increases the risk of developing the disease. This statement indicates the need for further teaching. Question 21. A nurse is assessing a 55-year-old patient with suspected bacterial meningitis. Which finding would require immediate intervention? A. Severe headache and photophobia. B. Positive Koenig sign. C. Sudden onset of irregular breathing and unequal pupils. D. Neck stiffness and fever. Correct answer, C. Rationale: irregular breathing and unequal pupils indicate brainstem involvement and potential herniation due to increased intracranial pressure, ICP, requiring immediate intervention. The other options are classic signs of meningitis but do not indicate an emergent, life-threatening deterioration. Question 22. A 19-year-old college student is diagnosed with meningococcal meningitis. Which statement by the roommate indicates a need for further education? A. I need to take the antibiotics prescribed by my doctor. B. I should wear a mask to prevent getting infected. C. Even though I have no symptoms, I may still be a carrier. D. I should get the meningococcal vaccine if I haven't already. Correct answer, B. Rationale: meningococcal meningitis spreads through respiratory droplets, and while close contacts should receive prophylactic antibiotics, wearing a mask is not an effective preventive measure. Vaccination and antibiotic prophylaxis are the best prevention methods. Question 23. A patient with bacterial meningitis has a Glasgow Coma Scale (GCS) score of 7. What is the nurse's priority intervention? A. Administer IV antibiotics. B. Prepare for intubation and mechanical ventilation. C. Reassess GCS in 1 hour. D. Elevate the head of the bed to 30 degrees. Correct answer, B. Rationale: a GCS score of less than or equal to 8 indicates a high risk for airway compromise and requires immediate intubation to protect the airway and support ventilation. Antibiotics, option A, are essential, but secondary to airway protection. Question 24. Which statement by a nurse about a septic, viral, meningitis requires correction? A. It is usually caused by enteroviruses and is self-limiting. B. It is treated with antiviral medications like acyclovir. C. It can present with fever, headache, and neck stiffness similar to bacterial meningitis. D. It is a medical emergency requiring immediate IV antibiotics. Correct answer, D. Rationale: a septic, viral, meningitis is not a medical emergency like bacterial meningitis, and IV antibiotics are not needed. It is self-limiting, often requiring supportive care. Question 25. A nurse is preparing to administer rifampin to a close contact of a patient with meningococcal meningitis. What should the nurse include in the patient education? A. This medication may cause orange discoloration of urine and tears. B. You will need to take this for at least 14 days. C. Avoid alcohol while taking this medication, but you may stop if symptoms resolve. D. This medication has no known drug interactions. Correct answer, A. Rationale: rifampin can cause orange discoloration of bodily fluids, which is harmless but alarming to patients. The course is typically 2 days, not 14, option B. Rifampin has many drug interactions, option D, and it should not be stopped prematurely, option C. Question 26. A patient with bacterial meningitis is placed in droplet precautions. Which nursing intervention is most appropriate? A. Maintain isolation for 24 hours after antibiotics are started. B. Keep the door open for ventilation. C. Use an N95 mask at all times. D. Maintain strict airborne precautions for the entire hospital stay. Correct answer, A. Rationale: droplet precautions are required for bacterial meningitis, but they can be discontinued after 24 hours of effective antibiotic therapy. An N95 mask, option C, is not required unless tuberculosis is suspected. Question 27. A patient with bacterial meningitis is receiving mannitol for increased intracranial pressure, ICP. What is the best indication that the medication is working? A. Decreased urine output. B. Increased blood pressure. C. Improved level of consciousness. D. Worsening headache. Correct answer, C. Rationale: mannitol is an osmotic diuretic that reduces cerebral edema and ICP. An improved level of consciousness indicates its effectiveness. A decrease in urine output, option A, suggests renal impairment, not therapeutic effect. Question 28. A nurse is caring for a patient with suspected meningitis. The provider orders a CT scan before a lumbar puncture. What is the most likely reason for this order? A. To rule out hemorrhagic stroke. B. To assess for increased intracranial pressure, ICP. C. To confirm the diagnosis of meningitis. D. To evaluate blood vessel abnormalities. Correct answer, B. Rationale: a CT scan before a lumbar puncture is necessary to assess for increased ICP, which could cause brain herniation when CSF is withdrawn. It is not needed to diagnose meningitis directly, option C. Question 29. A patient with meningitis has been NPO due to a decreased level of consciousness. The healthcare provider orders nasogastric (NG) feeding. What is the nurse's priority before initiating enteral nutrition? A. Assess bowel sounds. B. Check for signs of increased intracranial pressure. C. Administer IV fluids before feeding. D. Elevate the head of the bed to 15 degrees. Correct answer, B. Rationale: increased ICP can cause vomiting and aspiration. Before initiating enteral nutrition, the nurse should assess for signs of ICP worsening, e.g., decreased level of consciousness, bradycardia, hypertension. Bowel sounds, option A, are important but secondary. Question 30. A nurse is reviewing discharge teaching with a patient who had viral meningitis. Which statement by the patient indicates correct understanding? A. I need to complete my full course of antibiotics. B. I should avoid contact with others for 14 days. C. I may have headaches and fatigue for a few weeks. D. I will need a follow-up lumbar puncture to confirm recovery. Correct answer, C. Rationale: post-viral meningitis symptoms like headaches and fatigue may persist for weeks. Antibiotics, option A, are not needed, and isolation, option B, is not required after discharge. Follow-up lumbar punctures, option D, are not routinely needed. Question 31. A 48-year-old patient with bacterial meningitis is receiving IV ceftriaxone. Which laboratory result is most concerning and requires immediate intervention? A. Hemoglobin 11.5 grams per deciliter. B. Blood glucose 105 mg per deciliter. C. Blood urea nitrogen, BUN, 36 mg per deciliter. D. White blood cell, WBC, count 12,500. Correct answer, C. Rationale: ceftriaxone is primarily excreted through the kidneys, and an elevated BUN, greater than or equal to 20 mg per deciliter, may indicate renal impairment, requiring dose adjustment. The other values are mildly abnormal, but not critical. Question 32. A patient with meningococcal meningitis is placed on IV fluids and vasopressors due to septic shock. What assessment finding indicates worsening shock? A. Increased urine output. B. Warm, flushed skin. C. Blood pressure 82/40 mm of mercury despite fluid resuscitation. D. Heart rate 90 beats per minute, regular. Correct answer, C. Rationale: persistent hypotension despite fluids indicates progression to septic shock, requiring vasopressor titration and ICU care. Increased urine output, option A, suggests improvement, while warm skin, option B, occurs in early sepsis, not late shock. Question 33. A nurse is assessing a patient with viral meningitis. Which symptom is most concerning and requires immediate intervention? A. Severe headache and photophobia. B. Fever of 38.3 degrees Celsius, 100.9 degrees Fahrenheit. C. Sudden onset of lethargy and confusion. D. Positive Koenig sign. Correct answer, C. Rationale: sudden lethargy and confusion may indicate worsening neurological status or a secondary bacterial infection, requiring immediate evaluation. The other symptoms are expected in viral meningitis, but not immediately life-threatening. Question 34. A patient with bacterial meningitis is receiving dexamethasone. What is the most important nursing consideration? A. Monitor for signs of hyperglycemia. B. Encourage a low-protein diet. C. Assess for tinnitus and hearing loss. D. Avoid concurrent antibiotic administration. Correct answer, A. Rationale: dexamethasone, a corticosteroid, can increase blood glucose levels, especially in patients with diabetes or infection-induced stress response. Hearing loss, option C, is a complication of meningitis itself, not dexamethasone. Question 35. A patient with bacterial meningitis has a lumbar puncture performed. Which CSF finding is most consistent with bacterial meningitis? A. Clear CSF with normal protein and glucose. B. Cloudy CSF with low glucose and high protein. C. Elevated red blood cells in the CSF. D. Elevated CSF glucose. Correct answer, B. Rationale: bacterial meningitis CSF findings include cloudy CSF, decreased glucose, and increased protein due to bacterial metabolism and inflammatory response. Option C, RBC elevation, suggests hemorrhage or traumatic tap. Question 36. A nurse is reviewing discharge instructions for a college student recovering from bacterial meningitis. Which statement indicates a need for further teaching? A. I should tell my roommates to take antibiotics as a precaution. B. I need to complete my full course of antibiotics, even if I feel better. C. I should avoid school and social activities for at least 2 weeks. D. I may experience fatigue for several weeks after recovery. Correct answer, C. Rationale: isolation is only required for 24 hours after antibiotic therapy begins in bacterial meningitis. The other statements reflect appropriate understanding. Question 37. A nurse is providing care to a patient with bacterial meningitis and increased intracranial pressure, ICP. Which nursing action is most appropriate? A. Keep the head of the bed at 10 degrees. B. Administer pain medication every 2 hours. C. Maintain a quiet, dark environment. D. Encourage coughing and deep breathing. Correct answer, C. Rationale: reducing environmental stimuli helps prevent further increases in ICP. The head of the bed should be elevated to 30 degrees, option A, and coughing, option D, can further increase ICP. Question 38. A nurse is monitoring a patient receiving vancomycin for bacterial meningitis. Which assessment finding is most concerning? A. Red, flushed skin on the upper body. B. Mild nausea after administration. C. Serum creatinine 2.1 mg per deciliter. D. Decreased WBC count. Correct answer, C. Rationale: Serum creatinine greater than 1.5 mg per deciliter suggests nephrotoxicity, a known side effect of vancomycin, requiring dose adjustment or discontinuation. Red flushing, option A, may indicate red man syndrome, which is a rate-related reaction, not true toxicity. Question 39. A patient with bacterial meningitis has seizure activity. What is the nurse's priority intervention? A. Restrain the patient to prevent injury. B. Administer lorazepam IV as prescribed. C. Apply oxygen via non-rebreather mask. D. Place the patient in high Fowler's position. Correct answer, B. Rationale: IV benzodiazepines, lorazepam, diazepam, are the first-line treatment for acute seizures. Restraints, option A, can cause injury, and oxygen, option C, is secondary after seizure control. Question 40. A patient with meningococcal meningitis suddenly develops disseminated intravascular coagulation, DIC. What is the nurse's priority action? A. Monitor coagulation studies. B. Administer IV heparin. C. Notify the healthcare provider immediately. D. Apply direct pressure to any bleeding sites. Correct answer, C. Rationale: DIC is a life-threatening emergency requiring immediate medical intervention. The nurse should notify the provider immediately for aggressive management. Question 41. A nurse is caring for a 5-year-old child diagnosed with bacterial meningitis. Which assessment finding is most concerning? A. Positive Kernig's and Brudzinski's signs. B. Irritability and refusal to eat. C. Capillary refill of 5 seconds with cool extremities. D. Fever of 38.9 degrees Celsius, 102 degrees Fahrenheit. Correct answer, C. Rationale: capillary refill greater than 3 seconds and cool extremities suggest poor perfusion and possible septic shock, which is a life-threatening complication of bacterial meningitis. Fever and irritability are expected findings. Question 42. A nurse is providing care for a patient with suspected meningococcal meningitis. Which of the following infection control measures is most appropriate? A. Maintain airborne precautions. B. Place the patient in a negative pressure room. C. Use droplet precautions until the patient has received 24 hours of antibiotic therapy. D. Allow visitors without requiring masks. Correct answer, C. Rationale: meningococcal meningitis requires droplet precautions until the patient has received at least 24 hours of effective antibiotic therapy. Airborne precautions, option A, are not necessary unless tuberculosis or another airborne disease is suspected. Question 43. A patient diagnosed with viral meningitis asks why they are not being given antibiotics. What is the best response by the nurse? A. Antibiotics are only used for bacterial infections, and your CSF results confirm a viral cause. B. You are not sick enough to need antibiotics at this time. C. You may receive a short course of antibiotics once your fever resolves. D. We are waiting for further tests before deciding on antibiotics. Correct answer, A. Rationale: antibiotics are ineffective against viruses. Viral meningitis is usually self-limiting, and supportive care is the main treatment. Question 44. A pregnant woman at 36 weeks gestation is diagnosed with Listeria meningitis. What teaching point should the nurse prioritize? A. You must deliver your baby immediately via C-section. B. You should avoid unpasteurized dairy products in the future. C. Your baby is immune to this type of meningitis. D. This infection will not affect the baby since it is bacterial. Correct answer, B. Rationale: Listeria monocytogenes is often contracted from unpasteurized dairy or contaminated foods, and can cross the placenta, causing fetal complications. Immediate delivery, option A, is not always necessary, but close monitoring is required. Question 45. A nurse is monitoring a patient with bacterial meningitis who is receiving mannitol for increased intracranial pressure. Which finding is most concerning? A. Urine output of 45 milliliters per hour. B. Serum osmolality of 325 milliosmoles per kilogram. C. Heart rate of 90 beats per minute. D. Blood pressure of 130 over 80 millimeters of mercury. Correct answer, B. Rationale: mannitol is an osmotic diuretic, and a serum osmolality greater than 320 milliosmoles per kilogram may indicate overdiuresis and dehydration, requiring adjustment of therapy. Question 46. A patient with bacterial meningitis is receiving ceftriaxone IV. What is the priority nursing assessment? A. Monitoring for diarrhea. B. Checking for signs of cytotoxicity. C. Assessing for allergic reactions. D. Monitoring blood glucose levels. Correct answer, C. Rationale: ceftriaxone is a cephalosporin, and patients with a penicillin allergy may have a cross-sensitivity reaction, requiring careful monitoring. Question 47. A nurse is reviewing laboratory results for a patient with suspected bacterial meningitis. Which CSF findings are most consistent with this diagnosis? A. Clear CSF, normal protein, normal glucose. B. Cloudy CSF, high protein, low glucose, high WBC. C. Clear CSF, normal glucose, elevated WBC. D. Cloudy CSF, low protein, high glucose. Correct answer, B. Rationale: bacterial meningitis is characterized by cloudy CSF, elevated protein, decreased glucose, and an increased WBC count. Question 48. A patient with bacterial meningitis is at risk for increased intracranial pressure, ICP. Which positioning intervention is most appropriate? A. Keep the head of the bed flat. B. Elevate the head of the bed to 30 degrees. C. Position the patient in Trendelenburg. D. Turn the patient's head sharply to one side. Correct answer, B. Rationale: elevating the head of the bed to 30 degrees promotes venous drainage and reduces ICP. Trendelenburg, option C, increases ICP. Question 49. A nurse is educating a family member of a patient with meningococcal meningitis about prophylactic treatment. Which statement by the family member indicates correct understanding? A. I only need treatment if I start showing symptoms. B. I should take the prescribed rifampin even if I feel fine. C. I need to be isolated from the patient for at least 2 weeks. D. The vaccine will immediately protect me from infection. Correct answer, B. Rationale: close contacts of patients with meningococcal meningitis should receive prophylactic antibiotics, rifampin, ciprofloxacin, or ceftriaxone. Question 50. A nurse is preparing to administer IV vancomycin to a patient with bacterial meningitis. Which nursing action is most important before administration? A. Ensure the patient is adequately hydrated. B. Monitor liver function tests. C. Assess the patient's renal function and hearing. D. Administer an antihistamine to prevent red man syndrome. Correct answer, C. Rationale: vancomycin can cause nephrotoxicity and ototoxicity, so the nurse should monitor renal function, BUN and creatinine, and hearing before and during therapy.